right, guys, I'm just so excited to be here in front of everybody. This workshop is called COVID-19 in the Mission Field of the Orthodox Church. And we are here to kind of explore a couple, I think, important things in this session of this workshop. So before I kind of get into the real meat or the real questions of what I want to discuss today and what I want you to start thinking about and us exploring together, is I just want to really quickly give you a short little background about the Mission Center. We are the Orthodox Christian Mission Center. And what do? Well, we take this gospel passage that the Orthodox Church has taken very seriously over 2,000 years, and we try to take it into action. So that go therefore and make disciples, we do that for the assemblies of the canonical Orthodox Church. And our vision is that all people may come to know the love of the Father, Son, and Holy Spirit. So I want to kind of start with this one reflection, that the lens through which we see our world, and now I've got this here, I've got to get rid of this. Sorry, guys, we moved forward way too quick. How do we get back? Nope. Back. There we go. Now I just have to get rid of this. Okay. The lens through which we see our world and this pandemic is colored by the world that we are surrounded by, the things we touch, feel, know, and understand. So I invite you who are all, curious about these things to come with me on a short safari around the world to see how others are being impacted. But first, before we go on our safari, some words that His Grace, His Beatitude Anastasios has shared that will give us hope. He says, in times of trial, the human soul spontaneously seeks a refuge from pain. It seeks protection in religious faith. Those of us who believe, we know that the human being is not the author of him or herself. There is a supreme reality for us. He is the inconceivable and yet truly existing being, the triune God of love. His relationship with humankind is unchanging. He has given us the right to ask for his help in all times, and especially in times of danger and sorrow. That's from our Archbishop Anastasios. So I want to really ask you guys to start thinking about this. How does faith, affluence, poverty, urban or rural lifestyles, and trust or distrust in the government impact our response to COVID-19? And we're going to kind of explore this on our safari. So here we go. We're going to start in Nigeria. And I don't know if there's any of you guys who are interested in reading, so please feel free. I've got a bunch of slides with some interviews, because on this safari, what I did is I'm taking you to Nigeria, Kenya, Bali, Guatemala, South Korea, and Albania. And we're going to go kind of around the world, and we're going to hear first a little bit of statistics like you see on this first page for Nigeria, but then some interviews with either our clergy, our missionaries, or in some of the situations, we've got some input from our hierarchs. So now Nigeria is really something that, I'm glad I started with this, because today I just got a chat that the Metropolitan in Nigeria is now hospitalized with COVID. So it's kind of coincidental that in a country that has only recorded 2,800 deaths from COVID with a 2% vaccine rate, that I think the reality, as we kind of explore with the interview, that it's going to be it's a challenging place. Because, for example, in Lagos, a city of 8 million people, there are only 10 approved government testing sites. And in the rural areas, testing is almost non-existent. Is this influencing why the numbers are what we're seeing here in the slide? And we're seeing the impact. Their agri-food system, their GDP fell. Household incomes have fallen. There's increases in reported poverty rates just in the last few months. And there's been lockdowns that are affecting schools, bans on markets and shopping. So we have here an interview with Father James Maba, and he's the assistant for the Metropolitan, the Archbishop, who is presently in the hospital with COVID. And this is from him now. He said he can't verify the death of anyone from COVID, but it's rumored that people have died of it. People are divided on the seriousness. There are those who dread it and observe the protocols. Others trivialize it as non-existent, a political ploy to defraud the masses, or pandemonium to sneak in a 5G network, which people consider satanic, into the African space. The pandemic adversely affects the income of our parishioners. They were required by the church, as mandated by the government, to wear face masks to attend church. And so church just wasn't happening for some time. And these mandates were barring people from attending. Even digitally, we were not equipped to offer services. So you have to imagine, a place like Nigeria, where there's a big cosmopolitan city with millions of people, and there is Wi-Fi and computers and everything, but the majority of our churches are in these very rural areas. And so these churches were not able to live stream or anything, and your average person doesn't have the ability to actually try to log into something like that. And so the churches suffered financially, and they have not yet recovered. And they could not conduct their normal processes of fundraising, this annual Thanksgiving event that they do. And donations from corporate and individual bodies have stalled, stipends and salaries delayed. And sadly, Father James said, church attendance has not returned to pre-pandemic levels. A lot of their activities have just come to a stop. There's been mandatory lockdowns, and only essential services were allowed for some time. Churches and mosques were targeted as areas where people were concerned that COVID was going to be spread, and schools in addition. The government tried to help with some, helping passing out of assistance, social assistance, but it was really poorly distributed. So I think in bold, you'll see the next two sentences that I just really want you to think on. COVID testing is available in the government health installations, not accessible in rural areas. And COVID vaccines, they are available, but as Father said, in limited fractions. And then you see just that fear of the vaccine. And so I want to pause just for a second. Does anyone want to just think on, life in Nigeria, where you're faced with that? Testing is not available. The government's just impacting everyone's livelihood. And here we are saying there's a pandemic, but people are really, really afraid of that. So any feedback? Any questions? If not, we'll just go right on.
I guess I would just like to add that I would like to say that it's very hard to know what it is like without snapshots like this. And so I just really appreciate it, because it's just really important information, and it seems hard to get otherwise. So thank you.
Thank you, sweetheart. Yeah.
I was going to add, it just feels very, like, my gut reaction is just very restricting. I just, it just makes me want to kind of crawl into a hole and hide. So
I know. Wait until we get through some of these other countries. And then we're going to contrast it with South Korea, which, has a lot of things that just are a sharp, polar opposite contrast to what we're seeing in Nigeria, in Kenya, in Bali, and some of the other places. So here we are, Kenya. Okay, again, a country, 4% vaccination rate, 2,800 deaths reported. Okay, but at least they're confirming a higher number of cases. Okay, so they closed their borders, they banned travel, they closed schools, they instituted curfews, and they feel that they were moderate measures. The government didn't come down quite as hard as in other places. But the one thing that, if you Google Kenya COVID vaccination, you keep getting these concerns that people in their news, in their their social media sites, that their huge concern right now is that when the vaccinations actually get there and start getting passed out, like that almost 1 million doses, that it's going to impact the ability to immunize children because of the syringes. Okay, so this is Bishop Marcos. We just actually did this event with him today, so I got to see him face to face. He says, many people that I know believe that COVID is serious, but those are the ones who are vaccinated or interested in getting vaccinated. There are others that believe it's just a conspiracy theory, just made up. It did affect the parishioners when the measures were strict, but can you remember more moderate? He says that the office work of the metropolis just continued as normal, except that fewer people were coming and knocking on the door asking for assistance. And in a lot of rural areas, people ended up going on with their lives as if nothing was happening as far as COVID. But from the government, the priests were asked to stop services according to the government mandates. But he said that some of the clergy know of cases, but he was a little bit separated from the cases. But the most important thing that he said is, if I may say, the people's problems here, suffering from poverty, malaria, yellow fever, and so many other things, maybe that's why God has showed his mercy and allowed the burden of COVID to be lighter. Just kind of shakes you up, huh? So he feels that the measures were really strict with the curfew hours and wearing masks. I think because it impacted your average Kenyan's life. Because imagine, especially in the clergy setting, these clergy, their wives stay at home, they garden, they grow crops, tomatoes, small gardens, and then they go sell these things. And so if now there's these curfews and limitations on taking their produce to the market, it affects their income. And we have really heard from places in this diocese and in the other 2 dioceses in Kenya that has really impacted the life of the average person. So again, here he's saying COVID testing is available, but mostly in the urban areas. Insurance, he thinks, does not cover medication or care for COVID. And that the big thing is that people fear the COVID vaccine. We're dealing with a number of people for these virtual teams in Kenya. And every time I get on a Zoom with them, I ask them, hey, have you guys gotten the COVID vaccine yet? And everyone says, no, we can't. But even if we did, I don't know if I would. So let's see. Next. Okay. We're going to go to Bali. Okay. Now Bali is, any comments before I go on to the next? Okay. Feel free to interrupt. I would love just to have a little bit of dialogue there, of course. So Bali is a place that it's an island nation. It's an island part of Indonesia, and they have 30% vaccination rate. But that is because their economy is dependent on tourists. In 2015, 10 million tourists visited the island. And that number was the last number that was available. But the estimate by their, their Better Business bureaus were expecting that tourism was supposed to hit 20 million by 2019, but then COVID happened. And that 30% of the islanders, their livelihood is dependent on tourism. And so COVID, they totally closed down the island. So 30% of people who worked in the hotel and the food industry, in the tour industry, as cab drivers, all were without work. So it wasn't until just about 3 weeks ago that the airport opened again for flights for visitors from only 6 countries. And those people needed to have a 5-day quarantine. So there's, it's really, really, really been tough there for the people in Bali. And the priest that, Father Stefanos Boyk, I asked him, because he's got 2 parishes, one on each side, the north and the south side of the island. How is this impacting you ministering to both parishes? And he said, we can't move. We cannot move at all, because for him to get a hired car to go from one side to the other, or even a bus, he has to get a COVID test and or have a vaccine card. Well, he lives in an area where he cannot get a COVID test and he cannot get a vaccine. Just imagine. So these are his words. My country has a big economical problem. There are a lot of poor people now because they've lost their jobs. Some people fear COVID. I know 2 who have suffered from it. It's hard to face. No one could visit them because their isolation was in people's homes, and they were told that no one could go in. And so, it's a strange predicament that they're in. He says, testing is available in big cities, but we can't travel. No vaccines, no travel. Vaccines you need to have 2 or 3 times. We can't travel and then quarantine for 2 weeks. It's expensive. So he's, it's just imagine. So in the one area where he is, he's saying, people can't work and they cannot even come to liturgy. It's only recently that they've allowed churches to function at 75% capacity. So now, just recently, they are able to have liturgies, but of course with masking. Okay. Any reflections or thoughts? Bali is a great place to go to visit. It's a great place if you want to visit the church and do something. But they've really, really struggled over these last year and a half. Okay, we're going to jump to Guatemala. You guys ready? Okay, a little bit closer. 24% vaccination rate. Deaths for a much smaller country, a tenth the size of Nigeria and or Kenya, 15,000 deaths. Okay, so maybe they're tracking a little bit better. The actual number of cases and actual death toll is from, places like not their health ministry, but people reflecting on what they're reporting there. The actual death toll is most likely higher because of the limited testing. And I think this is what we're seeing in other places too. Limited testing and problems in the attribution of the cause of death. And then just the, notes right below that, all of their livelihoods are impacted, reduction in, whether it's palm oil, farming, rubber, livestock, dairy, whatever it is, there's been a drop in demand and worldwide demand and in local demand. They're closing down shops and stuff like that. So we interviewed Father Thomas and Pres Elizabeth Manuel, and they're two of the, maybe there's like 6 or 8 long-term missionaries in Guatemala. And so they start off with, they know many themselves have struggled with COVID. The vicar, a nun, and many of the seminarians have also come down with COVID. In this setting, no one has passed away here. In the village of Aguacate in September 2021, it was estimated, though, that 9 people passed away from COVID. And he goes on, estimated, because there's no way to really confirm if, in fact, it was COVID, but in all probability it was. Because, again, it's the testing that's just not available. So someone gets a flu-like symptom. In some places, they're counting it as COVID, but in most places, they're not. Only one community was enacting safety protocols and wearing masks, because Father Thomas travels around to a number of the communities to minister to them. And he says only one of these communities he visited, they were wearing masks. Most people attend church without a mask or without worry about COVID. The seminary was unable to offer classes in person for a while, and then we transitioned to online. Most ministries were not able to continue, but recently they have resumed. So, we tried to send a team to Guatemala to serve at the clinic in the village where he lives. But there were, looking up the travel restrictions, it is really pretty crazy how many restrictions. And they have themselves listed as red when related to COVID. He said at first the government managed the situation well. Masks were required, curfews were set. And in his village, he said they came through once about 4 weeks ago and they did a vaccine clinic. But he says that people really fear the vaccine, though. So there's not really a lot of information going out about the vaccine except for the fear factor. And he goes on now, and here's a new thought that is entering into how people in a nation are impacted by COVID. There is a long history and reason for mistrust of the government by the indigenous people that is a result of the Civil War. So people don't trust the government or even believe COVID is real. So here, people's history, so poverty, and now their history and distrust of the government is impacting their response to COVID. He said, we heard of a situation recently where a village is actually fining people if they have left the village to go get the vaccination, or if people come into the village with the vaccine. Wow. So any thoughts on something like that? It's just, I don't know. Okay, now we've got 2 more countries we're going to visit. Hopefully we can get to them quite quick. This is South Korea, which, we watched things unroll in China, and then we heard a lot of stuff in the news about South Korea. South Korea has 366,000 people confirmed cases and deaths 2,800. So a lot of these countries have similar numbers of people who have passed away. One huge difference is that there's a 75% vaccination rate in South Korea. They introduced what many have considered one of the best organized epidemic control programs in the world. Their measures included mass testing, isolation, tracing, and quarantining. High-risk patients were prioritized for hospitalization, which, that's a question we ask sometimes, who gets hospitalized when there's a limitation on what can be provided. And so they came up with, a process of moderately ill patients go to a government shelter. So what they did, though, was really, really, really amazing. They traced you with your phones, with your credit card data, with footage that, videotaping in the cities. So that was pretty severe. And if you were positive, or if you were supposed to be quarantined, if you moved out of your quarantine because they caught you with one of these means of tracing, you could be fined. Okay. All right. Now we are talking now with Father Chris and Jen Moore, who are long-term missionaries in South Korea. And they kind of gave us a little snapshot of what they're dealing with in South Korea there. Biggest thing was the limitations on the people being able to attend church. But there was not a financial impact on the church. People would mask, they would social distance, they would follow the government, mandates on how many people could come together. But the most important thing that I highlighted here in the dark bold is that this has affected our ability to maintain relationships with one and another and to continue the liturgy after the liturgy. So that's, something that has not yet come up in Nigeria, Kenya, Bali, or Guatemala. I thought that was pretty interesting. Another impact of COVID. And he goes on to talk about, canceling Sunday schools and online classes and all of the things that they've tried to continue doing, because that is who we are as Orthodox. That community is so important. And he was able to identify how that has really been impacted by COVID, even though they have the higher vaccination rate and they have such a good healthcare system. He goes on to laud the government, and that COVID testing is easily available and free in most cases, and that they're really pushing to get that vaccine out. And he, down at the bottom of this page, he said, yes, some people fear the vaccine, but the high vaccination rate shows that there are fewer people who fear the vaccine and more people who feel a societal responsibility to get vaccinated. And that comes from that social mindset of a lot of our Asian brothers and sisters, that, you do what's right for the nation, you do what's right for other people. And then the government, people trust the government there. And so people are getting the vaccine and they're financially able to provide it, and the free healthcare, which we saw wasn't available in a lot of other places. Okay, Albania, this is our last country. So we've got another country poor and very behind the times. So we've got a smaller number of confirmed cases, 2,900, and this is a very small nation, not even 5 million people. It's a very small nation with 2,900 people reported that have passed away. 30% vaccination rate, but interestingly, 70% of teachers, they're tracking things in a different way. 70% of teachers report being vaccinated. Right as soon as COVID was identified, they were right next door to Italy, and a lot of Albanians traveled back and forth from Italy to Albania, and we saw what happened in Italy on the news all the time. So their president declared a war on COVID-19. And you see there people were, very, very, very strict. And you'll see in a second when we get to the interview part, that a very strict curfew, and people were banned from, people were fined if they violated that. So we start with an interview with Father Stefanos Ritsi, and he says, we often hear of individuals with COVID The Archbishop was the closest that they knew to them that had COVID. There are clergy, parishioners, and people who have passed away from the virus. So it's such a small, close nation. And he said that some people believe that it's a serious disease, but many follow social media posts and COVID. I just saw a chat come through, but I can't get to it. So interrupt me if you need to interrupt me. Especially damage social media in such a small, tight-knit nation. Social media becomes like what people trust because the government is not trusted. And so here the power of social media is extremely damaging because they're the ones that are discouraging the vaccination and challenging people's faith if they take precautions such as masking and isolating. So, yes, there was a huge lockdown. And during the lockdown, church services were stopped. The church supported, though, the government mandates. And the lockdown was kind of like this. You had to register to go out of your house to grocery shop. And when you registered and you were given permission by text message to the police department, then you had 1 hour to run out, do your grocery shopping for the day, and then get back home. And so children were locked in their homes. People were, most people were not able to work virtually. So life really, people's livelihoods were really impacted. Few individuals, though, were really willing to follow the rules. People think they know better. There's a lot of skepticism, doubt, disbelief. And the people are still promoting that the vaccine carries this microchip in it. So what did the government do? They tried to imitate what Italy and Greece did and what Germany did, but they didn't have the resources. So COVID testing there is available only by private pay, meaning that no insurance covers it. So people have to pay about $150 for a COVID test. And that is, if you imagine the average person's monthly salary is between $300 and $2,000. So $150 is a huge chunk. Okay, we've got 2 more slides. And I want to give you a short little quote that the Archbishop has used in a lot of his international correspondence. And he uses this often, and that's why I kind of want to share it with you because it, I think, is one of the leading missiologists in our church, something that reminds us of who we are. He says, "Beloved, we are astounded as if a new world war has been declared by an invisible enemy, the coronavirus. We're all standing uneasily before the unseen changes brought about by this unprecedented pandemic to the life of the rich and the poor, to the educated and the simple, to health, economy, transportation, and various forms of leisure and celebrations." And I think, when I read that, I was like, oh, I hear him talk about Bali, Guatemala, Kenya, Nigeria. I hear him talking about each and every one of those places. It behooves us to avoid panic, depression, and despair. Composure, sobriety, and careful concern and discipline towards the instructions and health directives of the responsible governments are required of us. Likewise, we owe wholehearted thanks to those who are tasked with maintaining public cleanliness, order, and information, and especially to the healthcare professionals who are on the vanguard of the battle for the care of the infected. So our Orthodox values just comes down to this. We are to love others, to reflect Christ, and to share his peace, his love, and his concern for his world with those in the church and those not in the church. Thank you.